Hi, the first question is about the medical impact of coronavirus and why we are concentrating and asking and requesting people to stay home. Uh, we don't know exactly the characteristics of this virus, but people that have studied have found that, for example, the process takes 14 days as opposed to 7. So the infection is longer. It also happens to be that apparently the contagion from one person to the other is stronger than the normal flu, which means that more people will be infected, conditional on the same number of contacts. Third, many people do not have any symptoms at all, which means that they don't even know they are carriers of the virus. And fourth, even those that will develop symptoms, they develop the symptoms much later, which means that they are having human contacts for a while before they develop any symptoms. So for all of these reasons is that the contagion of this virus is so aggressive. And we can see the number of cases growing exponentially, incredibly fast. And I think that that's one of the reasons why they are so concerned about the spreading of the virus. So how can we understand the issue of contagion? In a normal virus, what is going to happen is that we will have a transmission of cases that will grow at the beginning exponentially, and then it will actually come down. And the problem with this is that when we think about healthcare provision, we need to be prepared to manage the peak. We need to be prepared to manage the highest number of cases. Now, the problem that occurs, and the problem that we think is going to happen with the coronavirus, and is happening in Italy and other places, is that unfortunately the capacity of the healthcare system is much smaller than that peak. And what is happening is that all these individuals, all these cases that are taking place are individuals that are not receiving the proper healthcare attention. So here the important things are the ICUs and the respirators, and the problem that is happening is that we just have too many cases. The contagion is too fast. So what we need to do, in some sense, is to slow down the contagion on this side of the exponential, and if we do that, we will be able to control those cases. At the end, the purpose is not necessarily to have less number of infections. If you think about it, it is conceivable that what we're going to actually end up doing is have roughly the same amount of cases, it's just that they are not spread out in the same way. By slowing down the contagion, we're just going to have the same amount of cases, which that means is that the area under the curve of the red one is going to be the same amount of people that under the black. But the difference is that the red line is below the capacity in the healthcare system. So when we implement the strategy of slowing down the process of contagion, what is going to happen is that even though we have the same amount of people, everybody gets attention, gets healthcare. When you're on the black line, which is too aggressive, the individuals on the top receive no attention. And therefore, even though at the end we're going to have roughly the same amount of people that will suffer the contagion and roughly the same amount of people that unfortunately this disease is going to kill, we are reducing the amount of death by the people that we are not attending. But this virus is not equal for everybody. The younger you are, the less affected the person will be. The older you are, the more affected. So for anyone that is older than 80 years old, 75 years old, the need to go to the hospital is about in 1/4 to 1/3 of the cases have to be in the hospital, and furthermore about 70% of those individuals require to enter an intensive care unit. So it's very discriminatory, the virus. It's profiling a group of the society, and therefore, and it's also very aggressive to those. If we get all those individuals sick on the exact same day, there's no healthcare system in the world that can help individuals. And I want to make this point, that this is irrelevant about the healthcare system that the countries have. This has been politicized tremendously, where they are saying that we should have healthcare for all. Even though I agree with that statement, this is not evidence of that. Countries like Spain and Italy have healthcare for all, and they are dealing very badly with the virus. And in fact, their healthcare system cannot actually adjust. I think that the only solution is to understand that we need a partnership between the public sector and the private sector. We need to train people really fast how to do intubations. We need to create more equipment to deal with the crisis. And in some sense, we need all to help the healthcare system. Otherwise, the number of deaths is going to be massive. And massive not necessarily because they're going to be killed by the virus per se. It's going to be killed. People are going to be killed because there will be no treatment. Countries like Italy are in what is called stage 4, which is more or less a state of war, where doctors need to pick who they are going to save and who they are not going to save. We don't want to get to that point. We want the spreading to happen throughout the population, and that those individuals can receive attention. This has important implications to how are we going to test and what are we going to do after the testing. It's very important that after you are found, you have been found that you have the virus, that doesn't necessarily mean that you have to go to the hospital. The question is if you have symptoms or not. So it's very important to stop the panic after the testing, etc. We need a lot of coordination at this stage, and in the point of the healthcare provision, we need coordination from us, the individuals, to stay home and reduce the number of contacts so we can spread this contagion as long as possible, not to overburden the healthcare system. I am absolutely certain we are all doing our part. You can do even more by trying to provide discipline to others. This is not easy. Isolation is a very difficult mental shock. So it's not only the health of our body, but the health of our minds that will be affected. So please reach out to your friends, reach out to your loved ones. Make sure that everybody is doing their part. This is very difficult. And hopefully we can get out of this with a minimal amount of unnecessary death from this virus. Just want to finish with, I heard today Angela Merkel address the German citizens. And I have to say that it was incredibly inspiring what she said. These are not easy times, but it is in all of us the responsibility to help the whole world. And I know that some of you do not have any symptoms, and you are, because of your age group, you are not at risk, but you will become a carrier. So this is the time where the greatest love that you can show to others is to stay home and to stay safe.